Subscribe to Saleswalah Studios and do not forget to click on the bell icon. Hello and welcome to another episode of Leisurely Batein. My guest today is Dr. Ravikumar Modali. Dr. Ravi is a medical doctor. He's a health, wellness, lifestyle practitioner and also a telehealth specialist. Dr. Ravi, welcome to Leisurely Batein. How are you doing?
Thank you, Subhadip. It's nice to having connected, and the order of the day is online activities. Real world has become challenging, so it's good to connect online and share some good thoughts.
Absolutely. Thank you so much. Ravi, what I'd like to start with is we hear a lot about, lifestyle, wellness and all these kind of things. Let me start by asking you, what is lifestyle medicine? How is it relevant in today's world?
So we as people across the world, we are trying to move into the new normal, a new way of living with stronger defense mechanisms in the places where we live for ourselves, and also with a better immune response system in our bodies. And all this against the pandemic contagion of COVID-19, which has come all of a sudden. I think that's the context, and lifestyle medicine is essentially centered around the responsible way of living. It brings in a lot of choices by which it helps people through this practice of lifestyle medicine to control reactions and become responsive in our way of life. We gain on behavioral intelligence and we nurture ourselves to healthy practices and formation of good habits. So putting it all together, I believe lifestyle medicine with its choices, what it brings in, it appropriately enables people to exit from the pandemic contagion and adopt the new normal.
Fantastic. Very well said and well explained. Well, that brings me to my next question. I mean, the last 60 to 70 days, primarily, we've been the word that we are hearing all the day, every day, hooked onto the news channels, looking at the count, is coronavirus. Right now, A lot of people have, found their own definition to define it. I'd like, as a medical professional, a doctor, explain to me and my audience, how does coronavirus spread? And there are a lot of myths that we are hearing every day, from friends, WhatsApp groups. What are some of the myths that are attached to coronavirus?
Yeah, very relevant question. So I think coronavirus is new to the medical community as it is new to the society at large. But what has happened, what is the global reaction which happens is the World Health Organization, which is the nodal agency for all the epidemics, pandemics since history, they were the ones who got into the act. And I think as a medical professional, it is important for me to stay in touch with all the new insights which are coming and all the recommendations which are coming from World Health Organization. So I would share from the understanding what has evolved till now. Coronavirus was essentially thriving in animals. In some instance, unknown, inadvertent instance or whatever it is, it happened that from animals it spread into humans. I'm not getting into the political aspects of that, but from the clinical point of view, the entry of coronavirus in humans came from animals, and the shocking thing, where it is a reality which we have learned together, is the human-to-human spread has been life-threatening. And that's where we are looking good that globally all of us have come together there is this global action has helped. So in India, I think we had the experiences from the other countries, and the central authorities were quick to respond where they announced the lockdown very early. Of course, it has been shocking, surprising for many of us, but yeah, I think that was what was appropriate at that time. So putting it in short, what is causing the spread, mainly covering the human to human, aerosols, when we breathe, the droplets which come out, and even the micro droplets as we breathe also, the virus is able to spread in the air. And this has been a very new insight, which is typical of coronavirus. I think it's more to do with the size of the virus. It's very small, and it tends to survive in organic matter as it's in the air. And that is the dangerous part. And, that's how the social distancing becomes so relevant. So aerosol is a new way what we have found out. Apart from that, hand-to-hand touch. Hand has varieties of bugs in it. And hand-to-hand contact was always known for the infections, and that is another mode. We are also seeing that fomites. Fomites means what? All the objects what we come in touch. Maybe the air sits on the glass panes of the window. Objects, if you are handling money, then money can have it. Plastics, metals. So varieties of these items have been found or suspected to carry the virus. Even if it's for 2 hours or 6 hours, that's a potential contagion. So I think the way the virus is spreading is, apart from the known ones, by objects, hand connects, connecting, shake hands, touching hands, and coming close together because of the air-related spread. So these are the ways how coronavirus is spreading these days.
Right. And what about the myths? There's a lot of myths that are going on. This happens, you'll get corona if you do this and from here. So what are the myths that, according to you, we should be careful as common people, not medical practitioners, but often getting very quickly influenced by these myths?
Absolutely. So I think what we were doing as a routine things before COVID-19 pandemic, all those activities have become risky. So yeah, clearly there is a lot of room for myths, and I think one of the commonest myth what I'm hearing is that this COVID-19 phase is temporary. It's going to fade away and everything is going to get back to normal. We can continue, we can return back to the same subtle risk what we were taking, being casual about hygiene, ignoring the immune systems. So I think that is an intense myth which cannot continue, that risky. And the second one, I would bring out that people are thinking that government is in control of COVID-19. So if the government announces lockdown, which means that is the intense phase, and if the lockdown is getting relaxed, it means, people are taking it as, I think we are safe from COVID-19, which is not the reality. I think the economic pressures, is where the government is trying to see what best can be done, and I think there's a balance it is trying to think of. So there are guidelines which are coming, and people themselves can be in control for themselves to protect from COVID-19. I think these are the two myths I wanted to share for your question.
It's fantastic. So what we want to also understand from you is COVID going to stay, and how are we going to adjust living, with COVID-19? Because, you'll see currently the lockdowns are getting relaxed. You mentioned about, economic pressures that we all are facing in our, respective professions. People are going back to work, airlines have started flying, conditions applied. But in all this, what would you advise people to be careful about as they get back to work?
Sure. I think if I see the statistics as the lockdown phase is getting relaxed, actually we are seeing the number of newly detected cases are going up. And that is what is being declared in the apps like Arogya Setu and all, which is a reality every citizen needs to know and respond to that. I would say that in simple terms, I would say information therapy is the key. Everyone should be well informed of what the central system has to say. I think today it's a good habit that we wake up in the morning. First, we see the COVID status in the Arogya Seva app, Arogya Setu app, and we decide on the day. And we are getting what every 12 hours there are updates which are coming. A lot of guidance is coming from Arogya Setu on a day-to-day basis, and the most important of them is like social distancing, which needs to be maintained even when people are moving. Then as the lockdown is getting relaxed for economic reasons, people are expected to take care of the personal protection. So personal protection is a necessary way of life, and the mask is a vital piece of that solution. Very simple to be done. If at all a person is methodical and doesn't compromise on using the mask well, then I think that itself is a very strong determinant to prevent the contagion to spread. So it is something like this. If one person wears a mask in a methodic way, which means the nose has to be covered, mouth has to be covered, and up to the chin, bottom. So if that is covered, you're reducing 70% of spread from human to human. If two people are coming close to each other, say 2 meters distance, if both of them are wearing the mask, the protection levels goes up as high as 95%.
Right.
So, I mean, that is one single most thing. And imagine if there are 7-8 ways to defend yourself and build your immune system, the amount of precision what keeps going on. So if you prevent unnecessary travel, you reduce the chances of getting the exposure itself.
Correct.
If you are cleaning the homes with alcohol-based detergents, Lysols and all, you are preventing fomites to be formed. If you are thinking of going to office spaces, and if you are ensuring the air conditioners are well filtered, the filtering effect is good, the ventilation is nice, and even if 5 people are working together maintaining social distance, you're not allowing air to get locked in. So you're allowing free flow of air. People can think of using alcohol sprays where you are able to sanitize the air also. So every 2 hours, if you are going to, spray in a closed room, your air is sanitized. So floor is sanitized, and these are the ways how you need to reinvent and re-engineer the places so that it holds good to prevent the spread of coronavirus, and we want to avoid the COVID disease happening because that is killing people, and that's where people need to be careful about improving their immune response systems.
Right.
Taking fresh vegetables, fresh fruits each day, drinking water every 1 hour of wake up, exposure to sunlight, 20 minutes of the good sunlight each day. These are all we can do anytime. What else? Believing in spices and herbs. There are healthy spices and herbs which have proven from the Ayurveda thinking, which is the Indian method of how it can be protective, and by nurturing the immune response systems in our bodies. So varieties of these things are there. As many what we practice, so much we protect ourselves at a personal level as well as protecting the community around us.
Correct. Very well explained, Dr. Ravi. What I wanted to ask you just on this note is we are hearing a lot about herd immunity, and some people are referring to it as like potential solution going forward. would like you to please explain to us, what is herd immunity? How does that, is that going to solve the problem? So yeah, over to you.
Sure, that's a very nice question, and I think people will appreciate its depth and meaning by this response. So the world has learned that the dangerous phase of the virus doesn't actually stay long, and what happens is the body tends to bring up its defenses, and there is a natural immunity which happens in the body. As well as there is an acquired immunity. After the virus comes in, there is a reaction which happens in the body, which we are facing right now. So natural immunity plus the acquired immunity, when it touches about 60% of the population, say in a community, that is the time when the community as a whole has reached the herd immunity. And what it says is the protection effect spreads between humans before the killing effect of the virus. That's what it essentially means in the English terms. But having said that, for COVID-19, what we are finding is the herd immunity is taking a longer time than the life-threatening effect what COVID-19 has posed. So on one side, we have people who are recovering from COVID-19 disease, and they are the people who are actually have the immune protection, either via natural ways, which were strong, typically children, or they have developed antibodies to the COVID-19. The current the virus for what it is, and they are the ones who can spread the protective immunity among people, but they are very few and they are growing in numbers. And ideally, we don't want to go through the infection phase for the acquired immunity.
Right.
What is a better way to reach herd immunity is naturally build your immune systems. Like what I said, the basic healthy practices what we can have, healthy food, avoiding stress. Stress is a confounding thing. It tends to blunt the signaling system in our body. And because of that stress hormone, the immune response is falling a little tardy. And, simple things like avoiding stress, gelling with people. Yes, physical distancing is an issue, but online connecting with people and sharing goodness and typical the human touch, what you can still sustain online. So these are the few methods where we can believe in building the natural immunity. And that essentially is definitely going to protect. Either it will reduce the load of the virus getting to us. The natural protection will be able to handle that less load of virus much better than an intense load of virus and challenging our immune systems. And also, if we are physically active well, blood is circulating well in the body, then it's not going to get, the virus is not going to get localized either in the lungs or in the skin or in the eyes. So blood circulation through physical movement is going to make it keep moving on, and there are better ways how the body can respond. And natural way is what I would suggest to reach the herd immunity, not the threatening infectious way.
No, very well explained, and I think when you explained it, it sounds very practical. It sounds very relaxing that it is not that you have to look into a very complex way and a fearful way which threatens the whole existence. So it's very well explained. One of the things you mentioned, Dr. Ravi, is stress. Right, and stress in today's time, with all that is going around us, professionally, job losses, and everything is something very unavoidable. But yet we have to be very conscious in managing it, and that itself is a very difficult thing. But one of the, there's a specific age group of individuals, the senior citizens, who are, I have seen, they're getting, affected in many ways because their life most of the times dependent on a support mechanism. especially if I have to use example of my own parents who live in another city. I'm based in Delhi, they're in Kolkata, and their existence is dependent on a support mechanism, around them.
Sure.
And I'm seeing, a lot of these people who are, living with chronic conditions, dialysis and other, ailments. There is an anxiety that is growing in them. And how, they are like also like, living in isolation. They're used to, a lot of social interaction, a lot of touch points, a lot of speeches. They're not as digital savvy. What's your advice, to the senior citizen community who are watching, who would be watching this episode? How would they manage themselves, their mind, control their stress and anxiety?
Sure, so important. I think I see two perspectives in the question you have posed. You started with the perspective of stress and jobs related issues, the work-life balance, as well as the senior citizens. So let me respect senior citizens and try to address their perspective first.
Correct.
And then we get into the stress and the work-life balance. So yes, for senior citizens, clearly they are the vulnerable section of our society, but they are the wiser part of the society, in the sense the wisdom what they have gained, the experiences what they have gained in life. They understand life much better than most of us. So, having said that, for senior citizens, typically if they plan their day well, it needs a different way of planning. You can't do the usual thing. You can't go to the parks to get that sunlight and, talk to friends, which is very important at that age group. So I think a humble suggestion is senior citizens getting comfortable with the use of smartphone for their regular living, as well as the comfort and convenience of purchasing all their essentials, including medicines, the daily needs, fruits, vegetables. I think fresh food is so important for them. Hygienic water, if at all, the tap water is not good. So I mean, for senior citizens, even the basic, simple things needs to be so well planned so that their day goes on well. Physical routines needs to be checked. So not being able to go into parks doesn't mean that senior citizens should stay at home and become sedentary. So we move from one risk to another. So to prevent that, there are simple exercises, bed exercises, chair exercises. There could be skipping, if people can do it. So things how it will keep senior citizens fit, well at their homes with proper ventilation. Some easy to use space sprays, which they can operate and maintain the air hygiene, floor hygiene. Maybe some mechanized tools are there which they can use. So I think they need to change their place of living, make it more hygienic in simple ways. Online access through smartphones is a very important tool in these times, and maybe ongoing also for them. So that is one perspective I've got into the mind. For, of course, medication. I think most of the senior citizens are on medicines, and they can't go to hospitals. It might be risky. So what the Medical Council of India has done is it has regulated telemedicine as an option, a mode of practice which users can think of adopting, as well as doctors can bring that option in their practice. Not many doctors have picked up on these basic skills of telemedicine, and they are trying to meet the standards which the Medical Council of India Act specifies. So from that point of view, I thank the Board of Governors of the National Medical Commission for having proactively thought about that and preparing the regulation of telemedicine practice guidelines. So senior citizens do have right now an option of reaching out to doctors through the mode of telemedicine, get their medicines delivered at home. So they can place a medicines order online, And there are many nationalized companies who are doing a very good job of enabling this option across India. So that these are the few things for the senior citizens. Coming to the point of stress and the work-life balance, I think the writing is on the wall that working from home is going to be the order of the day for most of the working professionals. I think the IT professionals have shown the way, and people like me, doctors in other fields who were not so comfortable with technology, are finding it easy to adopt it and come to the working ways. So many industries are right now thinking of what all perspectives, what all activities, what they've been doing can be done in the online mode. So people need to travel only if it is absolutely necessary, only if the activities cannot be done online. So from that point of view, there is a transition, a welcome transition, I should say, where I think people need guidance to how to adopt that. I'm sure there are a lot many advisors who want to offer these solutions, which are going to come up. So working from home is one. And the second aspect, the stress. Am I exposed to coronavirus? It's not easy. Symptoms are not coming. This coronavirus besides me. So from that point of view, I think one solution, I think one issue which takes people to stress is fear.
Right.
And I would like to just break the anxiety around fear by just putting an extended form. So fear, according to me, is nothing but false effect of an assumed reality. FEAR. False effect of an assumed reality. Now, if you understand that, immediately say, oh, fear, I mean, it's a false effect. Yeah. Am I assuming the reality? I think so. So what is the solution you want to look at? From the solution, quickly I'll come to the solution of information therapy. Use information as treatment. So for all questions related to COVID or coronavirus, Arogya Setu is from the government of India is doing a fantastic job of giving up-to-date information. I think everyone who's stressed, who wants to really come out well, should adopt Arogya Setu in their mobile phone and spread the use of it. Encourage many other people, mainly the senior citizens. Self-assess yourself in the app. You need not tell anybody besides. Self-assess in the app. The central system will know. They will keep the privacy of your details and all. And the community besides you is able to know how many cases yesterday reported as fever. How careful we should be. If yesterday there is a case, we should be methodical of using the mask and the hygiene practices more. That's a simple transition what needs to happen.
Right.
So information therapy has a lot much to do, and this I'm talking about COVID, but typically for a work atmosphere, say office and all, using whatever the online tools, so many are there: Telegram, WhatsApp, Slack. All these are organizing information for each purpose so well that it's not difficult to transit to the online mode of working. It's only a transition. Transition always in that changes. There are anxieties, there are curiosities, but having known the information well, we should enjoy transiting rather than always feeling the pressure that am I doing the right thing or not.
Correct. So very well put, Dr. Ravi, and I think that you also explained, how important is technology and the role of technology going to be going forward in healthcare post COVID-19. And we really got a lot of important information, a lot of insights from you. Thank you so much for being on the show. It was lovely talking to you, and I wish you all the very best for your future and all the good work that you're doing, and look forward to seeing you on the other side of COVID-19, either in Delhi or in Bangalore, over a cup of coffee.
Thank you, Subhadip. And I would wish all the listeners strength, courage, and will to adopt the new normal and come out with a strong intent to come out winning. All the best to all of you. Thanks for listening to this show.